I am Dr. Miniji Pillai. I am an endocrinologist practicing in Kochi, Kerala at Lakshmi Hospital, Ernakulam.
How does Imeglimin fit into your regular practice with the current landscape of T2DM treatment options? Kindly share your experience.
Imeglimin is a very novel drug in the treatment of diabetes. So, as we all know, diabetes is a very common problem and it is one of the 10 leading causes of death. Even though we have so many molecules to treat diabetes, often diabetes is uncontrolled because of reluctance to take medicines, because it is a chronic disease, and also because many a time the treatment does not cover all aspects of diabetes. So more and more drugs to treat diabetes is always welcome because diabetes remains uncontrolled in the majority of our patients. Now we have very many options in treatment of diabetes, but Imeglimin is particular in that it has a very novel mechanism of action. It is an oxidative phosphorylation inhibitor and it addresses the mitochondrial dysfunction, which is a feature of type 2 diabetes.
In what specific patient populations do you see the greatest benefit of using Imeglimin?
Imeglimin is useful in most people with type 2 diabetes. It is a molecule without much side effects. It does not cause much of hypoglycemia, and usually I use it with patients whose fasting blood sugar is difficult to control. At the same time, it brings down post-meal blood sugar also and also HbA1c. So it is useful for all aspects of diabetes.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy? Kindly share any real-world case if you have.
Yeah, actually, like I was saying already, this is a relatively safe molecule. So, like many a time, the first treatment that we use in type 2 diabetes is metformin. It is a well-established molecule, a very old molecule, a very useful molecule. But at the same time, rarely some people cannot tolerate this wonderful medicine because they have gastrointestinal upset, stomach upset with metformin. So in such people, Imeglimin is useful. At the same time, one of the side effects of Imeglimin, actually the most common side effect of Imeglimin is also nausea and decreased appetite, stomach pain, etc. But it is much less. So another thing is regarding its usage in clinical practice, I have been using it. We have this molecule since about 1.5 years now in India. So I have been using it generally after lifestyle modifications and after metformin, if it is not controlled, especially if the fasting blood sugar is not controlled, and also like people who are on multiple other medications, oral medications, and even people who are on insulin, who has a predominantly fasting hyperglycemia. In all of them, like patients who are on multiple OHAs, also I have been adding on Imeglimin.
In recent time, Imeglimin sustained release formulation with Indian study has been launched in India. What is your opinion on that?
Yeah, Imeglimin, like always with sustained release preparation, we are hoping for less GI side effects and a more smooth mechanism of action. So Imeglimin sustained release also the effect is similar with lesser GI side effects and with more tolerability and efficacy.
How does the mitochondrial targeting mechanism of Imeglimin influence its clinical use?
Mitochondrial targeting mechanism, as I have already mentioned, it is a very novel, very unique mechanism of action. Actually, mitochondrial dysfunction is a non-pathogenic factor in type 2 diabetes, and by addressing this, it decreases the oxidative stress. So oxidative stress can lead to long-term complications of diabetes, like cardiomyopathy, neuro, which can cause diabetic neuropathy. So all these complications, long-term complications, may come down with imeglimin use. And in the short term, the mechanism of action of imeglimin as such, it improves the insulin sensitivity, it decreases the insulin resistance, and like we said, it improves the oxidative phosphorylation, it improves the cellular energy metabolism, which is a key area of dysfunction in type 2 diabetes.
What are the key safety and efficacy findings from clinical evidences on imeglimin that clinicians should be aware of?
Basically, imeglimin is it is quite a safe molecule. So we don't expect much side effects other than rarely a person may have GI, that is abdominal pain or nausea or decreased appetite. And all treatment for diabetes, we have to be careful regarding hypoglycemia. Imeglimin is not a molecule with a very high risk of hypoglycemia, but still we must remember that people with diabetes have an inherent tendency. They are more at risk to develop hypoglycemia than compared to a non-diabetic person. So we should always be alert regarding hypoglycemia, and this is a relatively new molecule. So we also have to be on the lookout for we always have to, in the case of newer molecules, we always have to be alert to unexpected side effects. Though none has been reported, we have to be on the alert.
Do you believe that imeglimin has the potential to change the future landscape of diabetes treatment?
Definitely, we need more long-term data, but this is a novel mechanism of action, and it definitely adds on to the current molecules which are available for treating diabetes. And there is a hope that the long-term complications of diabetes, because these occur because of oxidative stress, the cardiac dysfunction, the neuronal dysfunction, the endothelial damage. Actually, imeglimin has been one of its mechanism of action is prevention of the mitochondrial pore opening, which is implicated in there is a study which showed that it decreased the epidermal cell death. So these long-term complications of diabetes, which is due to oxidative stress, we hope that imeglimin may be able to address. It may be one of the molecules which may turn out to be effective in addressing this.
Would you like to share any key points or take-home messages apart from this?
Imeglimin as such, especially imeglimin sustained release tablet also, it is a useful addition to the molecules which we have for treatment of type 2 diabetes. Thank you.